Before we do any tissue work, we'll pre-test his positions. So the main ones we'll pre-test, typically going to be ER, IR, and some type of overhead on the arm. Okay. If we wanted to get more specific, depending on the patient's movement patterns, maybe we could do cross arm, or if there's anything else, we can do that too. So when we're doing the lat and the subscap, we'll get under the ribs, in between here, and then we'll start with just a hold. As we start to go a little bit closer to the armpit, we'll get more in the subscap, and that's usually a pretty spicy spot for people. As we go closer, we start going more distal, then that's when it could be more lat based. For people that haven't had this in the past, we could just start with a hold. And then as people start to get more comfortable with this position, then we could take them into ER. Some movement with it. All right. And then if we also want to take them into flexion, that's fine too. So in my hand position, I have one hand grabbing under their elbow, one hand stabilizing in between my ribs and my arm, and then their hand supported, should be relaxed at all times as we're going through. If we find a spot that's pretty tender, we could just stay at it, hold, and then once it starts to release or loosen up, then go through some movement.